in this video, I want to talk about 5 things that we are seeing for 2026 and how it impacts your Medicare decision and also your overall health cost for healthcare. So again, in this video, let's kind of dive into those things so you can understand what to look for as you are making your Medicare decision. I'm Emily with the Medicare Coach, an independent Medicare consultant, helping our clients easily navigate both all the insurance company options, but equally, sometimes even more important, the actual government Medicare rules to help you get the most out of your Medicare benefits to have great healthcare, while also protecting your retirement savings. I'm going to share some free shortcuts and resources down below to make your life easier with Medicare as well. So as we head into 2026, there are a few things that I'm seeing that impact how we think about Medicare, your decision that you make, as well as your costs. So let's go ahead and hop into those things. Number one is the overall premiums when it comes to Medicare. Now, most of you still pay nothing for your Medicare Part A premiums, but most of you will pay for your Medicare Part B premiums, whether you stick to traditional Medicare or if you join Medicare Advantage. So the monthly premium for Medicare Part B, as in boy, for 2026 is $202.90 a month. So $202.90 a month. This is increasing from $185 from last year. So it is a significant increase, not the biggest we've ever seen, but it is a larger increase that we've kind of expected. Now, the Part B deductible for 2026 is also going up slightly to $283 for the year, which is up from $257 from last year. Again, not major, but it is an increase there as well. Now, for those of you who do have a higher income, there are what's called income-related monthly adjustment amounts, IRMAA, or high-income penalties, we sometimes call them as well. And that threshold for paying a high-income penalty hasn't increased all that much. And so your penalty threshold is if you are making over $109,000 a year if you file as an individual, or $218,000 if you file jointly, you will pay more for Medicare Part B as in boy, as well as Medicare Part D as in drug. Now in 2026, they're looking at your 2024 income to determine if you were above or underneath that threshold. So again, that threshold has kind of stayed pretty much the same from last year. No big change there. So on a premium basis, the fundamental change that we're seeing, or the most impactful change that we're seeing, is that Medicare Part B premium increase. Now, as a reminder, there is a rule called hold harmless. And that rule says if you were drawing Social Security, that your Medicare premium cannot increase more than your cost of living adjustment that Social Security gave you. So for most of you, you're still going to pay this $202.80 or $202.90, excuse me. But if you are on Social Security, you've already been on Medicare, you could be subject to a lower premium amount because of the COLA requirement, the COLA rules, okay? Now, if we hop on kind of the next talked about item for 2026, and there is an AI pilot program getting kicked off in 2026 called Wiser. It only applies to a few states: New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. There's a lot of chatter around this, and it is a significant change in some ways, in that for the first time and in a lot of ways, original Medicare is requiring certain prior authorization requirements. Now, I don't know how this will turn out, how the pilot will turn out. It's going to be a 5-year pilot program. But what I would say is I'm not totally opposed to it. I think what they're really trying to figure out is, if you look at the list of services that have to go through prior authorization, they tend to be kind of borderline, is it medically necessary or is it not? Now, Medicare will cover medically necessary services. But again, if you're getting a nose job for whether it be better breathing or just for cosmetic purposes, it can be a gray area or other things of that nature. And so I'm not totally opposed to this prior authorization. It's not great, but I'd almost rather the doctor have to prove to you if it will be covered or not before you go through the surgery. I don't see the same thing happening with original Medicare as we see with Medicare Advantage. We tend to see a lot more denied claims in Medicare Advantage. I don't expect that to happen with original Medicare. I still think they're going to be approving a lot of these claims. So I think it's to be curious to kind of see how the whole system plays out. But I'm not totally worried at this moment about this Wiser pilot program for those of you in those states. So we'll watch and see what happens. We'll keep you updated. But I would say don't panic. It does not change how we think about an original Medicare versus a Medicare Advantage recommendation. Those are still kind of very fundamental decisions. So Wiser pilot is rolling out. We will watch to see what happens. I don't have any initial massive concerns at this moment in time. Now, the third thing that we're seeing for 2026 is the average Part D premiums are increasing slightly from 2025. So the average Part D plans are stated to be around $38.99 a month, which is slightly up from 2025, which was $36.78 a month. Now, as we did our 2026 reviews back in October and November, we were seeing a lot of changes happening, right? About 63% of our clients changed plans, and on average, they saved around $2,000 on medication costs. A lot of those were actually from premium changes and getting them into a new plan with a much lower premium. What we saw last year in 2025 is that most states had pretty affordable Part D drug plans, especially at a lower premium level. However, California and New York were still pretty expensive. What we're seeing in 2026 is that California has come back to very normal premium amounts. New York is still high. So what I say that is like the cheapest plan in a lot of areas in New York is like $35, and the cheapest plan in California in many areas is like $5. And so we are seeing New York as an outlier when it comes to Part D premiums. Again, there's a way to kind of figure this out in most states. In New York, it's tough when your premiums are so high. But my point is, when you hear this number of the average Part D premium is $39 a month, you might pay less than that, or you might pay more than that. We do have some clients where their cheapest plan for their medications is over $150 a month. So that could be the case. But again, the goal overall is look at total medication costs, premiums, copays, your pharmacy, all of those things to get the lowest costs. Now, the medication cap for 2026 is increasing to $2,100 from $2,000 in 2025. So we're seeing a slight increase there. Again, it's $100. It's kind of annoying, but it's not the end of the world for most people. So just be aware of that. Again, Part D average plans are changing, but California got a little bit of a break while New York is unfortunately still stuck at those higher premiums. Okay. Now, the fourth thing that we're watching is Medigap premiums, Medicare supplement plan premiums. Over the last 12 months, we have probably seen the largest supplement premium increases that I have seen, especially around supplement plan G as in George. And it's interesting to watch it because, we saw a few increases after COVID, but we're kind of seeing, and I think we're gonna have more companies follow, but we're having more changes in this space around these prices. In some ways, we have a process at the Medicare Coach. We're going through costs, right? We're going through premiums. We're going through out-of-pocket costs. We're going through kind of calculating risk as to what makes the most sense for you monetarily, as well as kind of peace of mind overall. And what I will say is this, is that I believe that the higher prices of a Plan G is making those other plans look a bit more attractive, especially those high deductible plans. And so, again, we're still running numbers with certain people, but the typical recommendation of a Plan G, and I've always questioned it for a lot of people, right? And that's why the Medicare Coach is different, because we don't sell plans, we don't make a commission off it. I'm not impacted by the premium, which drives the commission. But I think that we should be questioning, is Plan G best for some people? And because of how Medicare's guarantee issuance rules work for most states, we have to think about it long term. But I would say that we are scratching our head more or helping our clients think about the risks and really the cost profile of a Plan G to decide, does it make sense or not? Because there have been very large premium increases when it comes to Plan G. Anywhere from 30 to even 70% has not been abnormal for us to see over the last 6 months. So be aware of that. I think that Medigap plans are fundamentally changing because of how the prices work. Okay. The final one we're kind of watching is Medicare Advantage. So Medicare Advantage, what we saw over the last few months as we did all the annual reviews for the upcoming calendar year, we saw that It seems as though there are fewer Medicare Advantage plans being offered. Companies are either consolidating plans down to fewer options or pulling out of the market completely, especially some of the bigger players. So we saw actually quite a few people who were losing their Medicare Advantage plan for the upcoming calendar year. Now for them, in some ways it's a good thing because they got what I called a golden ticket. They can go to a new company now. They can go to Medicare Supplement with no underwriting, which is great for them. But I think it impacts how you think about a Medicare Advantage plan still as you approach Medicare for the first time. We want to keep in mind that number one, plans can go away, right? The Advantage plans can go away, and in some ways, you kind of hope that yours does because you have so many more options in that way. But if you go into Medicare Advantage, again, the way that networks are set up, the way that doctors are set up, you have to be very thoughtful. Because doctors are being more specific on the Advantage plans that they're accepting, it's incredibly important as you first join Medicare to get really clear from your doctors what Medicare plans do they accept, especially Medicare Advantage. Now, yes, on original Medicare, we still have that risk of a doctor dropping original Medicare, but you have a lot more flexibility once you're already on original Medicare. So if you are joining Medicare for the first time and you're thinking about Medicare Advantage, one, ask your doctor which plans do they accept. Number two, ask your provider, are you planning on leaving any of these plans in the near future? And number three, if your doctor were to drop all Medicare Advantage plans, what would be your next alternative? Is it new doctors? Is it new plans? What would you think about? Because again, when we first join Medicare, it does have long-term implications, so be thoughtful around that. So those are the 5 things that we're watching in 2026. We will always keep you updated as we see more. But again, my goal is to help provide transparency into the Medicare system so that you can do what's right and best for you. Medicare is a really great and valuable resource if you make the right decision for you, and we got to get it right the first time. So thanks for being here. I'm Emily with the Medicare Coach, and I look forward to helping you, again, easily make your right Medicare decision.